Since you're watching us on YouTube at this point, if you have not subscribed to our YouTube channel, please do that. I know that that's kind of selling you on something that you haven't even seen yet, unless you've seen prior videos. Then you know how great things are, so you'll want to subscribe to our YouTube channel. What I'll say is, if you have not watched any of our videos before, at the end of this, if you like what we have to say, or even have any interest, then I'll encourage you to subscribe to our YouTube channel, as well as to go to Facebook and like us on Facebook. That way you get notifications when we are live on Facebook. Like right now, you'll get a notification earlier in the week saying that we're going to be live. You'll find out what the topic is. And then if you subscribe to our YouTube channel, you'll also get notifications when we upload this video to YouTube. And that gives you 2 ways of viewing on Facebook, YouTube. I hear that both are quite popular these days, and so you may want to look into that. So this week, well, it's Thursday, it's 1:30. My name is Dr. Ammitai Worob, so it must be time to go live on Facebook here with our topic of the week. This week's topic is the question, is chiropractic good for kids? Is chiropractic good for children? Which we're going to talk about this week. And next week, we're going to talk about similar topic, which I'll announce at the end of this video. What I will say at the beginning, however, is that we are going to do it on a different day and same time next week, because next Thursday at 1:30, I will not be available to do this. So we're going to push it up to Tuesday next week. So we're going to shoot live on Tuesday next week, following up on today's topic, where we're going to talk about kids and chiropractic. So the question is chiropractic good for kids? You know, really when it comes to anything in healthcare, the 2 most important questions are, is it safe and is it effective? So you have to satisfy the first criteria before you can even move on to the second, right? Because, heroin is quite effective at relaxing people and providing euphoria. However, it's not safe. So until you satisfy that safe criteria, there's no sense in moving on to how effective it is at anything, right? So the really short story, and this is one of our first videos, is chiropractic safe for kids? The answer is yes. Is anything 100% safe for anybody, like drinking water even? No. Like you can choke on water and inhale it into your lungs. Like there's everything, there is a risk to everything in this world. However, for the purposes of statistical significance, chiropractic is safe for kids. It's safe for adults. Chiropractic, ultimately when it comes to healthcare too, we're looking at the most important thing is coming up with the correct diagnosis so that you can give the correct prognosis for the condition and then render the correct treatment plan. So the nice thing about chiropractic is you don't have to be in pain, you don't have to have a condition to benefit from chiropractic. There is about 1/3 of our practice members come in really for what we would call wellness care, which is they're asymptomatic, they're highly functional, and really what they're looking to do is enhance performance, whether it's enhance their athletic performance, you know, playing softball on Monday and Tuesday nights, whether it's that now we're in, 5K, marathon, half marathon, triathlon season for our athletes, that are exercising daily and want to improve performance, whether they're 40, 50, 13, 83. The clock is not working in our favor once we pass about 18, 20 years old. So chronologically, we're always getting older, but physiologically, we can turn back the clock. Now, when it comes to kids, the important thing is, like I said, up until about age 18 or 20, we're in an anabolic state. We're growing, we're growing, we're growing. And I forget who it was, but someone maybe more poetic and smarter than me once said that as the twig is bent, so grows the tree. So, or as the tree is bent, so grows the branch, or something like that. Which is, if there's a problem while we're growing and we don't correct that problem while we're growing, we're going to continue to have that problem. That problem's going to get bigger and bigger and bigger. And that's where bringing in a kid to a chiropractic office can be hugely beneficial. And the nice thing too is with in terms of identifying a problem before it really is a big problem. When it's a small problem, when it's a pebble in your shoe, it's, you feel a difference. It may be an annoyance, but if you walk around with a pebble in your shoe and you start to put more weight on the other And you do that over 5, 10, 20 years, and then you get a hip replacement because you've been putting more weight on that one side the whole time when all you had to do was take out a pebble. It makes sense to take the pebble out, right? So identifying a problem that is small, maybe even asymptomatic, because 95% of our nervous system controls our autonomic function, how we breathe, our heart rate, our digestion, our hormones, controls our motor function, how we move, controls our sensation, what we feel. But only about 1 to 2% of our nervous system, in that small 5% that controls sensation, only about 1 to 2% controls pain. So 98% of our nervous system has nothing to do with pain. So you can have dysfunction before you get to pain. That's why we see people who are, can develop, have late stage cancer who had no symptoms till it got to that point, because the pain sensitivity of those organs is not high. There's a lot of function going on there, but they're not particularly pain sensitive. And so things progress. Same thing with first symptom of heart disease, 50% of the time is a heart attack, of coronary artery disease. So, identifying a problem before it's a big problem is one good reason to bring someone to a chiropractor. And again, having established that chiropractic, when it is the correct intervention, is safe, and when correctly applied, is safe. The other thing is, like I said, in terms of performance enhancement, people who are and there's a study after study, and these are big population studies, that people under chiropractic care report better energy level, more control of their health, report higher levels of function in creative thought, in higher level thought, and end up spending less on healthcare overall, even though that you increase the expenditure of your own healthcare by utilizing chiropractic care. It's a small fraction compared to what you're saving by not having to utilize reactive medical care. Doesn't mean there's not a time and a place for it. Of course there is. What I'm saying is that you can reduce healthcare costs over our lifetime, and by utilizing chiropractic. And this is one thing I mentioned in a presentation. When it comes to health and wealth, is the number one expenditure we'll have in our lifetimes is on healthcare. Number one, it's not even close. So the best financial investment you can make is taking care of your health. And the best time to start investing in your health, just like the best time to start investing, it's setting up a 529 college tuition for your children, setting up, different financial instruments earlier in life, saving earlier in life, so that, those things can accumulate over time. It's the same thing with our health. If we are banking our health early in our lifetime with exercise, people that have less incidence of diabetes, stroke, heart disease, often, or people who are exercising earlier in their lives are getting protective benefit. Same thing with neurocognitive benefit. The more active we are with our bodies, the more we utilize our functional bodies, the more protection we have against things like cognitive decline, Alzheimer's, heart disease, stroke, diabetes, etc. So banking that health early on is another reason one might want to bring their child to a chiropractor. I can say that kids are highly adaptable. So unlike us adults who are kind of like set in a certain way, and we're changeable. There's neuroplasticity, and we can change all throughout our lifespan. But the time where we are most likely to make big change in a short period of time is as a child, when we're grown. It's the same thing about learning an instrument, learning a language. Much easier as a child than it is as an adult. Learning a sport is much easier as a child than an adult. Try learning, if you've never learned how to swim, or if you've never learned how to hit a baseball, and then you try it as an adult, much more difficult than as a child. So, bottom line is chiropractic good for kids? The answer is yes. Some kids, in my practice, I see kids of all ages. I'll say that probably the population that is most underserved when it comes to chiropractic are kids, particularly infants. That's not an area of strength for me, but we have a couple of practitioners. There's 2 chiropractors in particular in our town who have a strong focus on pediatrics. And when parents bring their infants in and I check them out, if there's something going on, I usually refer them to those pediatric chiropractors. particularly when it comes to infants. And some kids I'll check out and there's nothing going on with them, and I'll say bring them back in a couple months or 6 months or a year for like an annual checkup or a biannual checkup, just like you'd go to the dentist to get checked out. If you're taking care of your oral hygiene, why not take care of your neurospinal hygiene? Because everything that we do in our particular world, our interface is our nervous system. How we experience the world, how we act in the world, it comes through our nervous system, and that's what we're looking at as chiropractors, is a healthy, clear, functioning nervous system, so that when our brain tells a muscle to do something, it actually does it. When our brain tells our toe to feel something, it actually feels it. So is chiropractic good for kids? The answer is yes. And again, it comes down to appropriate diagnosis, prognosis, and treatment plan. And the same thing like with dentistry, having regular checkups. For adults, checkups tend to need to be more often because, our bodies are breaking down more. But as kids, if we can make those small adjustments, and that, that's a question that I get a lot, is like, as children are not necessarily just small adults, so they require different techniques and different analysis than adults do. But ultimately, we're looking at making an intervention for better brain-body connection. So I'll talk more about this next week. I think next week I may expand what we started on today and talk about, where do I see chiropractic helping kids out in my practice and other practices here and throughout the country, where your kids may benefit from chiropractic services. At the very least, one preview, I guess, for next week is, I would say, just like anything, just like, we go for our annual physical with our medical doctor, our primary care physician, just like we get routine blood labs, just like we go for our biannual checkup and cleaning at the dentist. It's the same thing. Regular checkups are always, whether we check our car in for our, oil change every 3,000 miles and annual workup on that. Getting an assessment of where we're at will always give us the clearest picture of what the right thing to do is next. So next week, 1:30, same time, but different day, Tuesday, here on Facebook Live and later on YouTube. If you haven't liked our Facebook page, please do that. That way you'll get notifications. If you haven't subscribed to our YouTube channel, please do that. That way you'll get notifications on YouTube. And I look forward to your comments and questions below. I really like it better when this is a dialogue. It tends to be more helpful for others, and ultimately, when that's the way that healthcare is going to get better in this country, is having a dialogue about health and really a grassroots movement of taking care of ourselves. So please comment below, ask questions below. We'll take questions and answer them in future weeks, so that this isn't just a monologue. I'd like to have a dialogue with you. Thanks, and I'll see you next week.